Hi everyone, we are Group 7 and our group mate is Chen Yibao, Chen Nam, Huang Jintong, Wang Jinong, and I am Chang Qi. And our topic is coronary heart disease. Then we'll simply talk about what is coronary heart disease and we'll call it as a short form CHD. And CHD is the most common type of heart disease and we can also call it as coronary artery disease and ischemic heart disease. This disease will caused by many factors and the main factor is the atherosclerosis. And this process will build a plaque and inside the coronary arteries, and it will narrow the arteries. When the time goes, the plaque will age and grow and will be ruptured, and will occur many acute symptoms like stable angina and unstable angina and some myocardial infarction. And there is some common symptoms that like chest pain, which will slowly lead to other area pain like shoulders, arm, back, neck, and jaw. Then we'll talk about the statistics in Hong Kong for the cases, 60 cases in Hong Kong. In 2016, there are about 11 persons died for the 60 per day. And according to statistics, it has shown that the male have a higher mortality chance for about 71%, and the female will have a 41.3%, which is lower. And the mortality ratio between them will be the 1.5 to 1. Next, according to statistics, we have seen an increasing trend in Hong Kong from 1993 to 2016. The death number have doubled in this year. So that in Hong Kong, the CHD is very common, and we have seen an increasing trend in Hong Kong. So that's why we are interested in this topic, because nowadays CHD is the biggest heart disease killer in Hong Kong, and we want to know how the CHD causes and the symptoms. And the last, we want to know the prevention and the treatment for the patient who suffer from the CHD. After that, we'll talk about the risk factor. For example, age, sex, smoking, diabetes, obesity, family history, and depression. The first will be the age. According to the statistics and the research, CHD risk will be increased by the ages. So that means the elderly will suffer the most. It's because the elderly also have lost their elasticity, so that the blood flow will be not that well. And the second will be there will be a sharper increase in the woman, especially the 55 or above age woman. The next will be the sex. And according to the statistics, they found that the male is more common to suffer CHD, and they have a high mortality rate toward the woman. That is because the male usually smoke. And the next one is we want to talk about is smoking. Smoking will take large amount of cholesterol, and which will lead to the blood pressure is higher, so that which will cause many several heart disease.
And then my name is Chen Yibao, and I'm going to talk about the screening test and then the diagnosis for coronary heart diseases. And then the main screening tests are antibody check, blood test, DNA test, and then the BP measurements. Those screening tests is used to screen out some high-risk group people, and then they are easily to get these diseases. If patients have a normal performance in the test, and then they will suggest to get a further testing, which is called diagnosis. And then after the diagnosis, if the results of the diagnosis is not good, and then they can treat the diseases at the early stage. And then I'm going to talk about the diagnostic test. Those diagnostic tests is to diagnose the suspected patients have CHD or not, and then we can give the treatment in the early stage. And then they have 5 diagnostic tests. And then the first one is ECG, electrocardiogram. The next one is exercise breath test. The next one is coronary angiography, and then echocardiogram. And then the last one is CD, coronary angiography. And then the common 3 is ECG and electrocardiogram. This is used to record the electrical signal. If the electrical signal pattern is not normal, and then we can confirm that the blood flow is not functioning well in the patients, then we can confirm that the patient may have these diseases. The next common test is exercise stress test. This is the one of the ECG, but the special is this test will check during exercise with ECG in the patients, especially for checking the stable angina. And then the last common one is echocardiogram. This is using sound wave to produce the image of your heart, and then we can observe the image, and then we can get the status of your heart, of for example, the functions, the blood flow, the BP, and then the doctor or healthcare workers may be confirm that the patient has or has not the ECD.
Then let me talk about the pathogenesis of coronary heart disease. It is a chronic heart disease, however. It can become lethal when acute heart syndrome occurs. The main cause is the atherosclerosis, which is the presence of atheroma in coronary artery, which can cause the partial and total occlusion of vessel. Let me talk about the development of the atheroma. First, there are 5 steps of the development. About the chronic endothelial cell injury stage, this is caused by the hyperlipidemia. This is the mainly low-density lipoprotein cholesterol, which is the bad cholesterol, toxin from cigarette and hyperglycemia and hypertension and virus, which is the bad cholesterol, which can cause the bad cholesterol deposits and the venous stroke. And about the migration of the inflammatory cells, this is caused by the low-density lipoprotein deposits, which will send the signal to the immune system and will cause the adhesion and the integration of monocytes to the inner endothelium. About the lipid accumulation and smooth muscle cell proliferation, this is in the local region. This is the macrophage will engulf the cholesterol. However, it can't engulf all the cholesterol and it will dead. And when the macrophage dead, it will release the cytokine to reinforcement. Then the cycle will repeat while the low density lipoprotein cholesterol keep deposits. And then the smooth muscle will start proliferate and migrate in the fatty plaque. The plaque structure formation stage, and to prevent the thrombogenic cell exposure to blood, the smooth muscle cells secrete the fibrous cap. They sort of split out the collagen and elastin protein cap to cover it. And then the calcium will also secrete in the plaque to make the plaque more hardened. About the last stage, that is the complicated lesion stage, that is will block and narrow the blood vessel. About the aphroma take role in coronary heart disease. When the aphroma partially block the coronary artery and heart workload increase, the stable angina will be caused. Moreover, the aphroma totally block the coronary artery. The acute coronary syndrome can be caused, such as the unstable angina and the heart attack. Then we have to know what's happened in the stable angina. First, when body workload increase, body need more oxygen supply to support the body action. Therefore, the heart rate will increase. However, the plaque narrow the coronary artery, the blood supply to heart muscle will decrease, so that can't meet the myocardial need. When less oxygen reach to the subendocardium, will trigger the release of cytokines such as the endocyne and the bradykinin, and stimulates the nerve fiber and give the sensation of pain. So the patient will feel uncomfortable pressure, fullness, squeezing, or pain in the center of the chest. Also, the recurrent and the intermittent episodes of substernal chest pain will also occur. Usually, the patient also will have last short time, 5 minutes or less. The most characteristic of the stable angina is it can be reduced by taking a rest or administrative coronary vasodilators.
Hello, I'm Huo Yizhong, and I'll introduce the acute coronary syndrome. This represents the total blockage of the vessel and caused by the plaque rupture, which will cause the thrombosis. But how it occurs? Actually, there are 4 types of rupture, and the rupture of the fibrous cap is the most commonly happened. And when the plaque is ruptured, the thrombogenic cell like the macrophage will expose to the blood, which leading to the clotting of the blood platelet, which is called the thrombosis on top of the plaque. It will extend the volume of the plaque immediately, and also it can cause by the tissue factor produced by the macrophage and the smooth muscle, which will activate the coagulation too. And this exposed plaque cell will form a solid state on the plaque, which will quickly totally block off the blood pressure and cause 2 diseases, the unstable angina and heart attack. And here is the unstable angina, which the symptom will occur unpredictably. It will occur at exercise, at rest, or even at rest. So how it be happen? There are 2 situations. The first one is the rupture of the plaque causing the thrombosis, and even we make the thrombosis will even make the there are less room to let the blood to pass, so it can't meet the oxygen needs to support the body at rest. So the symptom occur. Second is the plaque. When the plaque rupture occur, there's not only the thrombocytosis and coagulation will occur, but the plaque will flip back and forth in the vessel, which sometimes will completely block the blood vessel, which will lead to the oxygen supply depleted at that moment in the downstream. And the myocardium will start to be hypoxia, and the symptom of angina, which is the sensation of pain, will occur. And other acute coronary syndrome is the myocardial infarction, which is called as the heart attack, which is an emergency and an irreversible condition, which means this is an acute heart muscle death from the lack of blood flow, which is caused by the complete blockage of the coronary artery, which they have 2 types of heart attack, which are NSD-EMI and ST-EMI. Actually, there are a few syndromes, like the chest pain is caused by the low perfusion of heart, and the dizziness of is caused by the low perfusion of the brain. Also, there have sweating will occur because this is a sympathetic response to increase the blood pressure to support our body action. Also, it also commonly occur in the left ventricle in these 3 blood vessels. The first one is the left anterior descending, the right coronary artery, and the left circumflex artery. There are 2 pathophysiology behind the heart attack. The first one is the thrombosis continuous occur. When the blood continues rupture, the thrombogenic cell will continue to expose to the blood and continue to activate the blood clotting, and the result will goes to the total blockage of the coronary artery. And second one is the thrombosis embolize and flow to the downstream. When the embolism flow to the downstream, it will also cause the complete blockage of other small arterioles, and this will cause to the function of the blocked section myocardium, the contraction and the conduction quickly lost. Okay, what happened when a heart attack occurs? In the first minute, the muscle will become ischemic, which the muscle do not receive enough oxygen, and the muscle layer ability to contract will sharply reduce. This is sensitive and can be reversible in this stage. But after the 20 to 40 minutes, the damage is become irreversible because the downstream of the muscle being blocked do not receive enough oxygen, and it will cause the necrosis, which will cause the death of the cell. If the patient artery blockage can be recovered on time, the death of the heart muscle will limit it, and the patient will just get the subendocardial infarct, which is the type of the NSD-EMI. But after 3 to 6 hours, that zoom of the muscle will extend to the entire myocardium wall thickness, which the necrosis will go through the entire myocardium wall, which will cause the transmural infarct, which is ST-EMI, which is the most severe type of heart attack.
Now I'm going to talk about the treatment. The first treatment is surgery. And then the surgery has two main surgery, which is common to treat the patients. The first one is angioplasty. Angioplasty is a procedure in which narrow sections of the coronary artery is widened. Angioplasty is in order to increase the blood flow to the heart muscle to treat the CHD. It requires open chest surgery, and the surgery can cause internal bleeding. So after the surgery, the patient may be moved to the recovery room and then get the healthcare worker to take care of him a period of time to avoid the internal bleeding. And then if the CHD happen again, another angioplasty or bypass surgery may be needed because angioplasty is only occurs in the part of the artery, not to continuous to avoid the CHD. And I'm now going to talk about the process of the angioplasty. Angioplasty has four main steps. The first step is put a balloon catheter into a narrow vessel. And then the next step is the balloon catheter will swollen and fix the size, and then to hold the wild sections of the artery. And then the next step is the narrow vessel will expand due to the balloon. Because the balloon has expanded, and then the artery is forced to expand. And then the last step is the blood flow increase to the normal stage because the artery has returned to the normal stage, and then the blood flow also will be returned to the normal stage. And then the catheter will be removed and then leave the stent into the artery. And then less or more chest pain because of the hypertension. Because after surgery, the significant feeling is you will feel less or no more chest pain because the hypertensions have been removed after the surgery. And now I'm going to talk about another surgery, which is called coronary artery bypass scaffold, CABG. When we compare to the angioplasty is better than this surgery because angioplasty has a shorter recovery time. And now I'm going to talk about the content of this surgery. This is a type of the surgery to improve the blood flow to the heart. And mainly graft artery or a vent bypass to the blocked portions of the coronary artery to connect another healthy artery, leave part of the oxygen-rich blood to flow to the heart muscle. And then we have the three types of this surgery. The first type is traditional coronary artery bypass scaffolding. You can stop the heart, and the heart lung bypass machine is used when the surgery is permanent, which means that it needs to open chest surgery. And then the next type is off-bone coronary artery bypass scaffolding. The heart keep bleeding, and then the heart lung bypass machine is not used when the surgery is permanent because the heart does not get any drug to stop it. You need to keep bleeding. And then the last type is minimally invasive direct coronary artery bypass scaffolding. The chest bone has not opened. That means this is not an open chest surgery. This type of surgery mainly is used to bypass blood vessel at the front of the heart, which means that this has a limit in the surgery.
I'm going to talk about the medication. Medication is used to prescribed by the doctor together with the surgery. Now I'm going to talk about the four common drugs. The first one is aspirin. Aspirin is used to an antiplatelet. The therapeutic effect in a lower dose can supply the platelet aggregation, reduce pain, and anti-inflammation. The patient will use it to relieve the chest pain, prevent shock, and the thromboembolic to use this drug. The second one drug is statin. Statin is used to reduce the cholesterol level in the blood. The therapeutic effect is can reduce the cholesterol biosynthesis, mainly in the liver. And it can modulate the lipids and metabolism, inhibit alpha-1 anxiety. Also, it can anti-atherosclerotic effect. The patient which use this drug have an ischemic attack, shock, and heart attack. And the third drug is nitroglycerin. Nitroglycerin is a vasodilator. The therapeutic effect in a lower dose, it can dilate the brain more than the artery. So therefore, it can reduce the preload of the heart, and more blood can go to the peripheral sleep. At a high dose, it can dilate the brain and artery and reduce the afterload. So in the result, the patient we can reduce the blood pressure. The patient will have angina and chest pain will this. And the fourth drug is warfarin. Warfarin is an anticoagulant. It can reduce the tendency of thrombosis and secondary prophylaxis. The main effect of this drug is to prevent the formation of the further blood clot and reduce the risk of embolism. Therefore, it can thinner the blood. And the patient we use it is the patient will have the shock, and after the surgery, which is the angioplasty and bypass surgery. The coronary heart disease is the most common coronary disease in Hong Kong. Due to the Hong Kong people have an unhealthy lifestyle such as smoking, drunk alcohol. Therefore, it is easily to occur atherosclerosis in the patient. When the patient occurs this syndrome, it is easily to die. So we suggest three methods. The first one is diet. We suggest you to eat the food have a lower fat, cholesterol, sugar, and the salt. We can lower the cholesterol and the blood pressure level to reduce the risk of the formation of fracture. The second one is do more exercise. It can increase the vessel flexibility. The last one is quit smoking and drunk alcohol. It can decrease the risk of the cause of epithelial injury. And this is our reference, and this is the end of our presentation. Thank you.